Hello all, welcome back to Midcode Navigator. Today I'll explain debridement procedures and its guidelines along with some CPC exam sample questions. So first we'll see the definition of debridement. Debridement is the removal of necrotic, infected or contaminated tissues to promote wound healing. ஸோ debridement என்ன அப்படின்னா wound ஹீலிங்கை ப்ரொமோட் பண்ணுறதுக்காக மேலே உள்ள டெட் ஸ்கின் செல்ஸ் ஆர் டிஷ்யூஸை ரிமூவ் பண்ணி எடுக்கிற ப்ராசஸ்க்கு பேர் தான் debridement. ஸோ மோஸ்ட் இம்பார்ட்டண்ட் ரூல் இஸ் debridement is scored based on depth, not based on location or severity. Next, types of debridement. We have two types. One is excisional debridement. The other one is non-excisional debridement. Excisional debridement is also called as surgical debridement. Excisional debridement uses scalpel, scissors or curette. If you see the terms like scalpel, scissors, curette or tissue is cut away means it is excisional debridement. Non-excisional debridement means you could see the terms like irrigation, washing, brushing or dressing. These are not coded as surgical debridement. Next we'll see the CPT codes based on the depth. For skin only debridement, we have to use the CPT code ranges from 97597 to 97598. If it is subcutaneous tissue, 11042. Muscle or fascia means 11043. For bone, 11044. So code the deepest tissue removed even if skin and subcutaneous tissues were removed. So always code the deepest tissue removed. Size rule. First 20 square centimeter is for base code. Each additional 20 square centimeter is for add-on codes. So remember, add-on codes can never be reported alone. Next, multiple wounds guideline. So if multiple wounds were debrided, we have to see whether it is same depth or different depth. If it is same depth, then we can add the surface areas together. If it is different depth means code each depth separately. So the core principle of debridement coding is we have to code debridement by depth of the tissue removed. So always we have to use the code that matches the deepest layer actually debrided. For example, if the provider performed bone debridement means skin, subcutaneous or muscle layer of debridement is included. So we have to pick the code for bone debridement. So next, common CPT ranges 11042, 11043 and 11044. Just memorize these CPT codes. These are very important. 11042 is for debridement subcutaneous tissue first 20 square centimeter or less. 11043 is for debridement muscle and or fascia first 20 square centimeter or less. 11044 is for debridement of bone first 20 square centimeter or less. Next, superficial wound care codes ranges from 97597 to 97598. Apply to non-surgical wound care, that is skin only. So if it is skin only debridement, we have to use 97597 or 97598. Next, size and add-on rule is very important. Base coat covers first 20 square centimeter. Additional surface area uses add-on coats. Next, skin graft interaction. Very important filling rule. So, debridement performed prior to a skin graft or skin substitute. It is included in the graft procedure. So, it should not be built separately. Okay. So remember, if debridement is done to prepare a site for skin graft or skin substitute, we should not bill debridement separately. Okay. So remember, if debridement is done to prepare a site for skin graft or skin substitute, it is not separately billable. Next, we'll see some CPC exam sample questions. First, the physician performed excisional debridement of a wound on the right lower leg. Skin and subcutaneous tissue 15 square centimeter, muscle tissue 10 square centimeter. Debridement was performed using a scalpel. So, first skin and subcutaneous tissue 15 square centimeter. So, skin and subcutaneous comes under the subcutaneous depth. Muscle is a deeper level. So we have to code both depths separately. First, skin and subcutaneous tissue 15 square centimeter. Next, muscle tissue 10 square centimeter. So the depth is different here. First one is subcutaneous level. Second one is muscle level, which is a deeper level. So we have to code both the subcutaneous depth and the muscle depth. So the correct CPT codes are 11042 and 11043. Next, two wounds, different depths. Operative note, two wounds were debrided on the left foot. Wound A, subcutaneous tissue 12 square centimeter. Wound B, muscle tissue 8 square centimeter. So excisional debridement using curate. So here the depth is different, that is subcutaneous and muscle depth. Different wounds, wound A and wound B. So we have to code separately by the correct CPT codes are 11042 for subcutaneous tissue, 11043 for muscle tissue. Third, same depth, multiple wounds. Contrast case here. Two wounds on the abdomen were debrided. Wound A is subcutaneous tissue 10 square centimeter. Wound B is subcutaneous tissue 15 square centimeter. So here same depth but sizes are different. So what is the rule? If it is a same depth, we can add the sizes together. So we have to add 10 plus 15, 25 square centimeter. So the correct CPT code is 11042 and 11045, because for first 20 square centimeter we have to use 11042, and for additional 5 square centimeter we have to use 11045. Fourth question, bone, muscle and subcutaneous. So let's see the operative note. Excisional debridement was performed on a chronic ulcer, subcutaneous tissue level, 10 square centimeter, muscle tissue level 8 square centimeter, and bone 5 square centimeter. So here we have three different depths and all three are separate sizes. So the correct codes are 11042, 11043 and 11044. Do not combine areas across depths. So depth changes the code, size changes the add-on. If you have any queries, please mention it in the comment section and follow Medcode Navigator for more CPC exam samples.